With Ophthalmology Times. The American Society of Cataract and Refractive Surgery is hosting a virtual annual meeting for 2020, and I'm joined by one of its presenters, Dr. Denise Visco, who is discussing an interesting new option for treatment of post-operative cystoid macular edema, iritis, pain, and photophobia following cataract surgery. Tell us about your presentation.
Well, I was very excited to make this presentation for ASCRS this year. I'm speaking on the effects of intracameral phenylephrine and ketorolac on cystoid macular edema, breakthrough iritis, and pain following cataract surgery. The purpose of this study was to compare the effectiveness of the intracameral regimen during cataract surgery with postoperative topical steroids in reducing the incidence of CME, breakthrough iritis, pain, and photophobia. And we had two different cohorts in this study. One cohort received purely topical medications with their cataract surgery. So it was 0.5% of loteprednol that was begun 2 days preoperatively and then tapered over a 4-week period. The study group received the intracameral phenylephrine ketorolac, and then both arms of the study received 2 days of bromfenac preoperatively and 10 weeks postoperatively. There were 2,218 eyes in this study, and we looked at the incidence of CME and, like I said, breakthrough iritis and pain and photophobia in both groups. The age, gender, race, and patient characteristics, concomitant medications, comorbidities, and such were very similar between both groups. We looked at all of those factors. And then we found that the incidence of CME was 3 times greater in the topical group than it was in the group that had combined phenylephrine ketorolac intracamerally and then only topical nonsteroidals postoperatively. Similarly, the incidence of breakthrough iritis was 2.5 to 3 times higher in the topical only group, and the incidence of pain after the first postoperative day with cataract surgery at any point in time in their 90-day postoperative period was also 3 times greater in the topical group. Photophobia didn't show any clinically statistically significant difference between the two groups. But what this means for us is that the regimens that are going towards less drops for patients may actually be better for them. So what do we look at really when we're trying to control perioperative inflammation? We want to make sure that the success of the surgery doesn't literally lie in the hands of the patient. So we want to make sure that we're using the most efficacious regimen, that we decrease the risk of complications, we decrease our outcomes on patient-dependent drug delivery. And I think all of those things are achieved with the intracameral phenylephrine ketorolac, and that has essentially replaced topical steroids in our perioperative cataract regimen. For my clinical practice is that the statistically significant lower incidence of CME, breakthrough iritis, and perioperative pain in cataract surgery patients with the phenylephrine ketorolac means that we appropriately control inflammation with cataract surgery, and that regimen may well be superior to protocols involving topical steroids and contemporary NSAIDs.